I'm Dr. Greg Nigh. Welcome back to the Deep Dive Podcast. Today, I'm going to talk to you about a therapy that I think is tragically overlooked. It's something that is accessible to everyone, and it's about the cheapest therapy that anybody could do. And I'm going to use just kind of a personal anecdote to tell you why I think this is important. And this is a story, I'm going to tell you about something that happened to me. Whatever, it's not like deep and personal, and I've shared this story with many patients who I felt like could hear this and get some good out of it. So I'm going to tell you about visualization, but I'm going to tell you in the context of a story about how I use this. So when I was in junior high, I was, athletic kid and played all the sports and all that. I just the short story is that I came down with an illness that nobody knew what it was. It was in my lungs, and then it went up into my ear, and it knocked out the hearing in my right ear and also my balance. I don't have any. Well, I have a very messed up equilibrium, very little balance. And most importantly, it ate through the nerve, the facial nerve, cranial nerve that controls the face. There's one on each side, and it comes through the inner ear and innervates all these muscles, innervates taste on each side of the tongue. So that nerve actually, because of an infection that developed in my ear, it ate through that nerve. I say ate through, it makes it sound dramatic, but it damaged that nerve to the point that it didn't work anymore. I couldn't hear, I didn't have the balance mechanism, and the function on this right side of my face didn't work anymore. And it if you've ever seen someone with Bell's palsy, it's exactly what it looked like. You could draw a line straight down the middle of my face. I couldn't close this eye completely. I couldn't, wrinkle this side of my nose. I couldn't smile on this side. All of this was non functional. Now, I'm in junior high at this point, and just kind of think about what impact it has when it, suddenly you look not like you used to look, and it did not go over well for me. I was not okay with having this half of my face never work again. Well, it just so happened that my dad worked at community hospital in Indianapolis. I grew up in central Indiana. And a friend of uh, his name was Jerry Wesch, who was the head of biofeedback at the hospital. And so Dr. Wesch, Jerry came to our house, drove out. I lived out way outside of Indianapolis, but he came to the house and he put me through a hypnosis, was what it was, a visualization process. And keep in mind, this is the early 80s. And so personal computers had very recently come out. I had a TRS-80 Radio Shack, the first personal computer. I learned basic programming, and so I'm just telling you that for background. I was into computers and just this new thing, a home computer, and so he leads me through this visualization process where I remember, I approach a door and I open the door, and then there was a series of steps. And of course, each time I'm going down a step, I'm becoming more relaxed and relaxed and relaxed. And I mean, I should tell you also, my dad, all growing up, my dad was a therapist and he used hypnosis all the time. And so hypnosis was something that I was very familiar with. And so this wasn't like a weird process for me. So, okay, so Jerry has me do this thing and I get to the bottom, and I remember I kind of once I'm at the bottom, I'm pretty weightless and I just sort of float out and I float down into this nice big chair, and there's a big screen in front of me, like a giant screen. And I see on this screen, it's like a computer screen, but and I'm seeing these, the nerve in here. I'm seeing it as like two ends of a rope that had been like severed and they're all frayed, and so there's all these strands, but they're not touching anymore. And I see it on that screen. And so, uh, I go through, and there's a reason why I did it this way, but there was this band of light that would just pass back and forth across that gap. And each time it did, another little strand would reconnect between those two, so that after a while, all the strands had now reconnected. And so that image I used to every night, every single night, without exception, every night, because this was gonna change. I was gonna do whatever it took to change this situation. When I got in bed for, I don't know, 30 minutes, probably, I would go through that process, seeing myself going down and relaxing, and then I'm in the chair and I see this image up on the screen of this rope and the light and the dun, 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 and and also part of this image was that there were all these workers, these guys that were there and welding, and they're getting that nerve rebuilt, kind of doing what they got to do to get everything reconnected. So there's all this activity, the light and the workers and the so every night I'm doing this as I'm laying in bed. And then after I go through the process and I have all the strands reconnected, then I would say to the people, the workers, I'd be like, all right, guys, I really appreciate, keep working. I got to go to sleep, but just go ahead. You could work all night and it's all good. So that they are just working on it all night while I'm sleeping. So I did that every night without fail. Now, keep in mind, when I was in, so when this whole thing happened, and it was literally overnight, I woke up and half my face didn't work. I couldn't hear. I had this blaring ring in this ear, which started in 1981 and is still going on today. Um, but all of that, it all happened uh, it happened all at once. And so, every night, well, the point of that is that then I got involved in therapies, the kind of physical therapy, to try to get things to start working again. It was just a little shocking device to try to keep the muscles exercised in case function ever came back in my face. But I had surgery on that ear and they stimulated the nerve with a lower, big voltage, but there was no reaction in my face. So the surgeon told my parents at the time, it's not going to come back. There's no message getting through that nerve at all. It does Nerves don't really grow back. That's not a thing. This was back in the 80s. Now we know that they actually do have some capacity for that. But the surgeon told my parents, yeah, it's not going to happen. Fortunately, they didn't tell me that. So I had every reason to believe that absolutely that's going to come back. So it's in that context that I went through this imagery, and then every night, just without fail, I would go through that visualization process, finish it by telling the workers to just keep working. So as a test every day, I would stand in front of the mirror and just heroic effort, see if I could get even a quiver of movement out of the corner of my mouth. Anything I could do, or anything, squint, anything. So every day I would try, and nothing ever moved. But I kept trying, and I kept doing that imagery. And then it was about 3 months after I had lost everything, so there was no movement. Right around 3 months, as I recall now. keep in mind, this is back in 81, 82, somewhere around there. I looked in that mirror, I gave it that strongest effort, and I saw a quiver of movement. I saw it happen. And I was like, yes. So that was what I need. That was the reward I needed to know that you just keep doing this. So every night I just kept going back and fixing it and fixing it and fixing it over and over and over. Visualization is a way of telling your body what you want to have happen and making sure that you show in the visualization what it looks like for that to happen. Now, it doesn't matter that you're anatomically correct. Doesn't matter. Like the nerve that I fixed was literally a frayed rope. It was just a rope with tendrils, and I just reconnected the rope. But my subconscious mind knew exactly what that represented, and it did the work. So I continued with that process over the course of, gosh, I don't know, it must have been another 6 months to a year of going in. And because initially it was just tiny little movements, and over time it built and built and built. And eventually, look at that. Now, it didn't build back exactly correct. There's still some wires got crossed, so now it's like when I smile really big, my eye squints. I don't care. That like ridiculous look that I had in junior high, it went away by going through this disciplined imagery process. So, the moral of that story is we all have the capacity to heal. And this is not in any way to say that we can always figure out how to tap into that, but it is there. Imagery, going through visualization, is one important way of tapping into the potential for us to heal whatever it is that we need to heal from. There are different ways of using imagery. They're not all, I did it one way. I'm a very visual. I see, anytime I'm reading or learning new things, I'm seeing a visual representation of things. So I definitely went through a visualization process that was focused on the visual and seeing it all happen. There are other people who are much more sensory. They really would do better, I think, going through a process that is much more focused on kind of a physical relaxation and sensory experience as part of that kind of provoked healing response. But uh, I present that as a case because I have a very personal uh, validation of how this works. That wasn't supposed to happen. And it certainly was not supposed to happen in the span of 3 months that I got movement coming back in the corner of my mouth. But I was highly motivated and I had a very specific ritual that I did over and over and over. So that is just call it a little bit of a cheerleading for anyone who's looking for some little extra oomph to put into their treatment program. Picture what you want to have happen and then show yourself having that happen over and over and over. It's in the discipline. It's like training for a marathon. You don't train, a day or two a week. You do it consistently. So I hope that has been of some value. If you did find it valuable, please do that thing and click like and subscribe to the channel. Love that. You can always, anybody would like to have a conversation about these things or maybe some specific, there are some YouTube resources and other resources that I think are valuable for people who want to pursue more integrating that kind of a therapy into their daily treatment program. gregnigh.com is how you find me. And I hope you will tune back in because I'll be back with another video shortly. Thanks.